Welcome to the spoken tutorial on personal hygiene needed for handling baby food. In this tutorial, we will learn about personal hygiene, guidelines to maintain it while preparing and feeding baby food. Let's understand why personal hygiene is important for handling baby food. Here, baby food means nutritious, home-cooked, complementary food. Such food must be fed to a 6 to 24 months old baby along with breastfeeding. At this age, the immune system of babies is not as developed as that of adults. They are vulnerable to catching infections and foodborne illnesses easily. If cleanliness is not observed, then complementary food may harm the baby. It may introduce infections which can cause diarrhea, vomiting, cold, and cough. Therefore, baby food must be hygienically prepared, cooked, stored, and fed. Let's learn how to maintain personal hygiene needed for handling baby food. Baby food preparation, serving, and storage areas should be always kept clean. Never cough, sneeze, smoke, chew gum, spit, or eat in these areas. Also, do not change a baby's nappy in these areas. Always wear clean clothing. Tie back and cover long hair properly. Keep fingernails short so they are easy to clean. Do not wear nail polish because it can chip into the food. Avoid wearing jewelry, especially on the hands and fingers. Keep clothes and personal items away from where food is prepared or stored. Do not let food and utensils touch any cuts or wounds on the body. Completely cover all cuts and wounds with an unused clean cloth or bandages. Do not let the cloth or bandages get wet. Change the cover on the wounds regularly, especially before touching the food. Do not touch the food if feeling unwell. Never cough or sneeze over baby food. Washing hands is the easiest, most effective way to stop the spread of disease. It reduces the chance of contaminating food with bacteria. To wash hands properly, use soap and warm water. Rub hands to lather soap on the back of the hands, under nails, and between fingers. Do this for at least 10 to 15 seconds. Dry hands immediately after washing them. Always dry them with an unused clean cloth. It is important to make sure that the hands are completely dry. Never use a regular towel, kitchen napkin, or your clothes to dry hands. Teach children to wash their hands. Take them to the bathroom or the place to wash hands. Sing a short song of about 10 to 15 seconds while they wash their hands. It will encourage children to rub and lather hands for at least 10 to 15 seconds. Set a good example. Wash hands together. While washing hands with children, tell them why it is important. Along with the technique, washing hands at the right time is also important. Wash and dry hands thoroughly before touching, preparing, or feeding baby food. Wash and dry them again frequently during food preparation. Sometimes you may take a break while preparing or feeding baby food. Always wash hands after such breaks and then continue. After preparing food, wash them again. Hand washing is also necessary after handling raw food and garbage. It must be done after going to the toilet, blowing your nose, and smoking. After touching animals, a sick child, or a sick person, wash hands again. Also, wash them after touching ears, nose, mouth, or other parts of the body. Always wash hands after checking or changing a baby's nappy. These personal hygiene guidelines must be followed while handling baby food. Additionally, there are other equally important baby food safety guidelines. They must be followed during preparation, feeding, and storage of baby food. They are discussed in detail in another tutorial of the same series. This brings us to the end of this tutorial. Thank you for joining.